Assalamu alaikum students, I am Dr. Ammara. Today I am going to discuss the descending tracts of the spinal cord. The descending tract is basically a pathway that conveys message from the cerebral cortex to the effector organs. This pathway is often made up of three neurons: first, second and third order neurons, as you already studied in the ascending tracts. The first neuron is called the first order neuron, has its cell body in the cerebral cortex. Its axon descends to synapse on the second order neuron, an internuncial or interneuron situated in the anterior gray column of the spinal cord. The axons of the second order neuron is short and synapse with the third order neuron, the lower motor neuron, in the anterior gray column of the spinal cord. Then the axons of the third order neuron innervates the skeletal muscle through the anterior root and spinal nerve. In some instances, the first order neuron directly terminates on the third order neuron. Now in this diagram you can see this is the first order neuron, and the axons arises from the cerebral cortex and they reach to synapse with the second order neuron in the anterior gray column, which is the interneuron, and the axons of the second order neuron then synapse with the third order neurons, which are alpha or gamma motor neurons, in the anterior gray column, and then the axons of the third order neuron innervates the skeletal muscles. When we see a transverse section of a spinal cord, the following descending tracts can be seen, which are of two categories: the pyramidal tracts and the extrapyramidal tracts. The pyramidal or corticospinal tract descends from the cerebral cortex to the spinal cord, and the extrapyramidal tracts are Rubrospinal Tract, Reticulospinal, Olivospinal, the Vestibulospinal, and the Tectospinal Tract. Now look at this transverse section of a spinal cord. In this transverse section, in the left half of the diagram you can see these descending tracts. In its anterior aspect, close to the anterior median fissure, there is anterior corticospinal tract, and along its anterior margin from medial to lateral there is Tectospinal Tract, then Vestibulospinal Tract, and then Olivospinal Tract. On its posterior aspect, close to the posterior gray horn, you can see a large lateral corticospinal tract, and close to it there is Rubrospinal Tract. The corticospinal tract. Fibers of the corticospinal tract arise as axons of the pyramidal cells, predominantly lying in the motor area of the cerebral cortex, and there is some contribution to it from axons of cells in premotor area. Then these fibers converge in the corona radiata and then pass through the posterior limb of internal capsule and then continues through the basis pedunculi of the midbrain. On entering the pons, the tract is broken into many bundles by transverse pontocerebellar fibers, and in the medulla oblongata these bundles become grouped together along the anterior border to form a swelling known as the pyramid. That's why this is called the pyramidal tract. At the junction of the medulla oblongata and spinal cord, most of the fibers cross the midline at the decussation of the pyramids and enter the lateral white column of the spinal cord, forming the lateral corticospinal tract. Its fibers terminate in the anterior gray column of all spinal cord segment. It means you can see the lateral corticospinal tract in all the spinal cord segments. The remaining fibers do not cross in the decussation but descend in the anterior white column as the anterior corticospinal tract. These fibers eventually cross the midline and terminate in the anterior gray column of spinal cord segments in the cervical and upper thoracic regions. Anterior corticospinal tract is not present in all spinal cord segments, but it only can be seen in cervical and upper thoracic regions. Most corticospinal fibers synapse with internuncial or interneurons, which in turn synapse with alpha and gamma motor neurons. Only the largest corticospinal fibers synapse directly with the motor neurons. This diagram shows you the corticospinal tract. The fibers arise from the cerebral cortex, then pass through the corona radiata and then the basis pedunculi of the midbrain. Then they reach the pons. At the level of the pons, they broken into bundles by the pontocerebellar fibers, and then they descend in the medulla. In the lower part of the medulla, most of its fibers cross the midline to the contralateral side and then descend in the lateral white column of the spinal cord, and then eventually reach in the anterior gray column where they synapse to the second and third order neurons, which are gamma motor neurons. Some of the fibers in the lower part of the medulla do not cross the midline and they descend in the anterior white column as the anterior corticospinal tract, but in the spinal cord they also cross the midline and they also synapse with the second and third order neurons. Now here are some important points to remember, and that origin of the corticospinal tract is from the motor area, and there are some fibers contribute from the premotor area. Pathway is the corticospinal tract and they pass through the corona radiata, posterior limb of internal capsule and the basis pedunculi of the midbrain. In the medulla oblongata, there are 75 to 90% of fibers cross to the contralateral side and descend in the spinal cord as the lateral corticospinal tracts. 10 to 25% of fibers descend uncrossed in the spinal cord as the anterior corticospinal tract and cross over at level of destination. And what is their destination? Internuncial or interneurons and the third order or motor neurons. Branches of the corticospinal tract. Some branches are given early in their descent and return to the cerebral cortex to inhibit activity in adjacent regions of the cortex. Now, some branches pass to the caudate and lentiform nuclei, the red nuclei, the olivary nuclei, and the reticular formation. These branches keep the subcortical regions informed about the cortical motor activity. Once altered, the subcortical regions may react and send their own nervous impulses to the alpha and gamma motor neurons by other descending pathways. Function of the corticospinal tract. The corticospinal tracts are the pathways concerned with voluntary, discrete, rapid skilled movements, especially those of distal parts of the limbs. Rubrospinal tract. The axons of the rubrospinal tract arise from the red nucleus, which is situated in the tegmentum of the midbrain. These fibers cross the midline at the level of the nucleus. It means the fibers cross immediately after they arise from the red nucleus. The Rubrospinal Tract descends through the pons and medulla oblongata to enter the lateral white column of the spinal cord and terminate by synapsing with the internuncial neurons. Here in this diagram you can see the fibers of the Rubrospinal Tract arises from the red nucleus which is present in the midbrain, and these fibers cross to the opposite side immediately at the level of the nucleus, and they descend as a Rubrospinal Tract to reach the anterior white column of the spinal cord. After that, they terminate by synapsing with the internuncial neurons and motor neurons present in the gray column of the anterior gray column of the spinal cord. The neurons of the red nucleus receive afferent impulses through the connections with cerebral cortex and the cerebellum, and this is believed to be an important indirect pathway by which the cerebral cortex and the cerebellum can influence the activity of alpha and gamma motor neurons of the spinal cord. The tract facilitates the activity of flexor muscles and inhibits the activity of extensor or anti-gravity muscles. Reticulospinal tracts. Before going into the details of reticulospinal tracts, you should know what is reticular formation. Groups of scattered nerve cells and nerve fibers exist throughout the midbrain, pons and medulla oblongata. These are collectively known as the reticular formation. Now, the origin of the reticulospinal tract. Fibers of the reticulospinal tract arise from the pons as well as from the medulla. From the pons, these neurons send axons which are mostly uncrossed down into the spinal cord and form the pontine reticulospinal tract. From the medulla oblongata, similar neurons send axons which are crossed and uncrossed to the spinal cord and form the medullary reticulospinal tract. Now, the reticulospinal fibers from the pons descend through the anterior white column, while those from the medulla oblongata descends through the lateral white column. Then these both sets of fibers enter the anterior gray column of the spinal cord and synapse with the alpha and gamma motor neurons after synapsing with the internuncial neurons. Important point to remember is that the reticulospinal tract arises from the reticular formation, which is groups of scattered nerve cells or nerve fibers present in the pons and medulla. Now, here in this diagram you can see the fibers of the pontine reticulospinal tract arises from the pons. Most of the fibers are uncrossed, while some of them cross to the opposite side and descend to reach the anterior white column of the spinal cord. After that, they synapse with the neurons present in the anterior gray horn of the spinal cord. Same as with the medulla, from the medulla, the medullary reticulospinal tract fibers arises. Some of them uncrossed and some of them cross to the opposite side to reach the lateral white column of the spinal cord, and finally they also synapse with the neurons present in the anterior gray horn of the spinal cord. Now, the function of the reticulospinal tract is to inhibit or facilitate voluntary movements, reflex activity, assist hypothalamus, control sympathetic and parasympathetic outflows. Tectospinal tract. Fibers of this tract arise from nerve cells in the superior colliculus in the midbrain. Most of the fibers cross the midline soon after their origin. ओके, नाउ व्हाट इज सुपीरियर कॉलिक्यूलस, ठीक है। ये सारी कुछ टर्म्स ऐसी हैं जो आप लोग आगे जाकर डिटेल्ड पढ़ेंगे, इसलिए आप इस वक्त सिर्फ और सिर्फ इन टर्म्स को याद कर लें। The tectospinal tract descends through the anterior white column of the spinal cord and terminate in the anterior gray column in the upper cervical segments of the spinal cord by synapsing with internuncial neurons. Some important points are here. As I already told you that origin of the tectospinal tract is from the superior colliculus of the midbrain, and they descend as tectospinal tract, and site of crossover is very important, which is immediately decussates at a posterior midbrain tegmentum, and they finally synapse with the motor neurons in the anterior gray column. Function of the tectospinal tract is reflects postural movements concerning sight. Here in this diagram you can see the superior colliculus are present in the midbrain, from where the fibers of the tectospinal tract arises, and they immediately cross to the opposite side and descend to reach the anterior white column of the spinal cord. After that they reach the anterior gray column, where they synapse with the internuncial neuron and then the motor neurons of the anterior gray horn of the spinal cord. Vestibulospinal tract. The neurons of the lateral vestibular nucleus give rise to the axons that form the vestibulospinal tract. The tract descends uncrossed through the medulla and through the length of the spinal cord in the anterior white column, and the fibers terminate by synapsing with the internuncial neurons of the anterior gray column of the spinal cord. Here you can see the lateral vestibular nucleus present in the pons, and the fibers arise do not cross to the opposite side and descend as the vestibulospinal tract to reach the anterior white column of the spinal cord, and these fibers terminate by synapsing with the internuncial or interneurons present in the anterior gray horn of the spinal cord. Now, what is the function of this tract? The inner ear cerebellum, by the means of this tract, facilitate the activity of the extensor muscles and inhibit the activity of flexor muscles in association of the maintenance of balance. Now the last one is the olivospinal tract. The olivospinal tract is thought to arise from the inferior olivary nucleus present in the medulla oblongata and to descend in the lateral white column of the spinal cord to influence the activity of motor neurons. Function is thought to be in proprioception and facilitate muscle tone. Here you can see the inferior olivary nucleus present in the medulla, and these fibers immediately cross and descend as the olivospinal tract to reach the lateral white column of the spinal cord, and finally they synapse with the internuncial neurons present in the anterior gray column of the spinal cord. But there is now considerable doubt as to existence of this tract as a separate pathway. Now, in the end of this discussion, some important points to remember is the names of the descending tracts. You should know the names of the descending tracts and from where they originate, which fibers are crossed and uncrossed, and if they crossed, then at what level, then termination level of these tracts and the function of the tracts. So that's all for today. Thank you.